Hello friends, welcome to the YouTube channel of Shree Swaminarayan Physiotherapy College. My name is Dr. Parita Shah and in this video I am going to talk about the Flutter device. The Flutter is a mucus clearance device which is shaped like a pipe with a hardened plastic mouthpiece at one end, a plastic protective perforated cover at the other end, and a high density stainless steel ball resting in a plastic circular cone on the inside. It is indicated in patients with mucus producing respiratory conditions like atelectasis, bronchitis, bronchiectasis, cystic fibrosis, chronic obstructive pulmonary disease, asthma, or other conditions producing retained secretions. It is contraindicated in patients known to have pneumothorax or overt right-sided heart failure. The efficacy of the Flutter as a mucus clearance device is based on two principles. The first one is the ability to provide intermittent positive expiratory pressure to the airways, and second one is the vibrations transmitted to the airways due to high frequency oscillations of the stainless steel ball. The intermittent positive pressure is provided when the patient exhales through the mouthpiece of the Flutter with the lips firmly closed around the stem. During exhalation, the force of the expiratory air pushes the weighted ball upwards and the air exits through the pores. But since the ball is heavy, it rolls down due to gravity, which is again followed by upward movement of the ball due to force of the expired air. This alternating upward and downward movement of the ball occurs rapidly and repeatedly, which alternately opens and closes the pathway of the expired air with a frequency of 6 to 20 Hz, that is 6 to 20 oscillations in 1 second. This upward and downward movement of the ball is called opening and closing cycle. When the ball is bouncing up, it is called the opening part of the cycle, and the ball rolling down is called the closing part of the cycle. During the closing part of the cycle, there is the development of positive pressure in the airways due to the resistance applied to the expired air. Now let us understand the two mechanisms by which positive expiratory pressure has its therapeutic effect for clearing the secretions in the airway. The first mechanism is splinting the airways open. Now look at the figure A, in which the airways are narrowed when the patient with retained secretions tries to do the forceful expiration or cough. Due to external forces on the airways produced during coughing, they collapse. But if you look at the figure B, which shows the effect of positive pressure on the narrowed airways, it is evident that positive pressure splints the airways open and prevent them from collapsing during expiration. This reduces air trapping and improves the expiratory flow. The second mechanism is opening of the three collateral ventilation channels, namely the channels of Lambert, the channels of Martin, and the pores of Kohn between the adjacent lobules and alveoli. In the alveoli obstructed by the mucus, the ventilation is poor. For proper ventilation to occur, the air should get behind the mucus and push it forward. When the patient expires through Flutter, the collateral ventilation channels are opened up due to positive pressure, and the air reaches the less ventilated alveoli behind the mucus. This air pushes the mucus forward, thereby removing the obstruction of the alveoli and make it easier for the patient to expectorate it. Along with the positive expiratory pressure, flutter also produces high frequency oscillations due to the rapid alternating movement of the ball rolling and bouncing up and down. When the oscillating frequency, which is 6 to 20 Hz, approximates the resonance frequency of patient's respiratory system, the oscillations are amplified and converted to vibrations of the airways, which cause a fluttering sensation. This is how the device derived its name Flutter. Now let us see the two mechanisms by which the vibrations produced by flutter improve the mucus clearance from the airways. The first one is alteration in the rheology of the mucus. Various studies have shown that in chronic infective conditions of lung, there is presence of two byproduct macromolecules, DNA and F-actin. These macromolecules form strong bonds with mucus glycoproteins, making it thick and viscous, which makes it difficult for the patient to expectorate the sputum. Now the vibrations applied by the high frequency oscillations in the range of 6 to 20 Hz break these bonds and reduce the viscoelasticity of the mucus, which facilitates the movement of the secretions to the central airways. The second mechanism is matching of the oscillating frequency of flutter with the beating frequency of cilia. Various respiratory conditions are associated with dysfunctional beating of cilia. When such patients exhale through the flutter, the vibrations match the frequency of beating of the cilia, which facilitates the expectoration of sputum. These effects on the respiratory system make flutter an important agent to the physical therapy in conditions with retained secretions and narrowed airways. Now, I will explain the method of application and directions for using flutter device in patients with impaired mucus clearance. The patient should be seated with back straight and head slightly tilted upward so the upper airway is wide open. This will allow exhaled air to flow smoothly from the lungs and out through the flutter. As an alternative, the patient may be seated with elbows resting on a table at a comfortable level or semi-Fowler's position. The angle at which the patient holds the flutter is critical. The oscillation frequency produced by the flutter when its stem is in horizontal position is approximately 15 Hz. This frequency can be modulated by changing the inclination of the flutter slightly up, that is higher frequency, or down, that is lower frequency, from its original horizontal position. Adjusting the flutter to the resonance frequency is easily accomplished by the patient who selects the angle of tilt that results in the best transmission of vibrations to his or her airways. Initially, the flutter should be held so that the stem is horizontal to the floor. Then it needs to be adjusted to the patient's pulmonary resonance frequency, which is done by moving the flutter slightly up or down to achieve maximum fluttering effect. The patient can know when this frequency is achieved by the sensation of vibrations within the chest. The physical therapist can help determine if the patient has achieved the maximum fluttering effect by placing one hand on patient's back and the other hand on the patient's chest. If the resonance has occurred, the vibrations in the lungs will be felt by the hands as the patient exhales. After the patient has established a comfortable position and selected proper tilt to maximize fluttering effect, the therapy may begin. The treatment is divided into two stages. Stage 1, which is mucus loosening and mobilization, and stage 2, mucus elimination. In stage 1, instruct the patient to slowly inhale to approximately 3/4 of a full breath. Place the flutter in the mouth with the lips closed firmly around the stem. Position the flutter at the proper angle and perform a 2 to 3 second breath hold. This allows the inhaled air to be evenly distributed throughout the lungs. Now the patient should exhale through the flutter at a reasonably fast but not too forceful speed. The cheeks stiff so the vibrations produced by the flutter are not dissipated in the cheeks. Have the patient concentrate on feeling the airways vibrate and continue to exhale through the flutter to a level slightly further than the normal breathing without a flutter. At this point, the urge to cough should be suppressed. Have the patient repeat this breathing technique for another 5 to 10 breaths to loosen and mobilize as much mucus as possible. The mucus moves farther up the airways with each flutter exhalation. Emphasize to the patient the 3 important things. First, inhaling slowly. Second, holding the breath for 2 to 3 seconds. And third, suppressing the urge to cough. Now the patient is ready to begin stage 2, that is mucus elimination. Have the patient perform 1 or 2 additional breaths through the flutter. This time, breathe in slowly and as fully as possible comfortably. The patient should not inhale to the point of discomfort. This is followed by 2 to 3 second breath hold. Now, have the patient exhale forcefully through the flutter as completely as comfortably as possible. This forceful exhalation moves mucus up to the level in the lungs that triggers a cough. However, if the mucus is not easily coughed out following 1 or 2 breaths, the patient should attempt a huffing maneuver. The standard series of 5 to 10 mucus loosening breaths of stage 1 with cough suppression followed by 1 to 2 mucus elimination breaths of stage 2 with coughing should result in successful airway clearance. If the patient is new to flutter therapy or has particular thick mucus, it may take multiple repetitions of stage 1 before performing mucus elimination, that is stage 2. Flutter therapy is complete when no further mucus can be expectorated following several sequences. The successful clearing of airways for most patients will occur in approximately 5 to 15 minutes. I hope you were able to understand indications, contraindications, effects, and application of Flutter device as a mucus clearance device. If you like this video, please give it a thumbs up sign and share it with your friends. If you have any suggestion or question, please write it down in the comment section below, and please don't forget to subscribe to this channel. Goodbye and keep learning.